Our next speaker is Dr. Todd WOLYNN, who's the Chief Executive Officer of Kids Plus Pediatrics. And Dr. WOLYNN's also the President of the Advisory Board for Shots Heard Around the World, which we heard about yesterday. So Dr. WOLYNN's going to talk about the role of physicians in building vaccine confidence and acceptance. Welcome, Todd.
Thank you. I'm going to share my screen. Are you guys able to see that? Looks like we're
yes.
Good. Terrific. All right, here we go. So thanks again, and very much a huge thanks to the National Academies to have the opportunity to speak. So I am Dr. Todd WOLYNN, CEO of Kids Plus, and co-founder and advisory board president of Shots Heard Around the World, and I am a vaccine avenger, or at least so says Dr. Z-Dog MD. So here we go. Okay, in ancient times before MTV, people feared infectious disease and they respected physicians' recommendations. But by the dawn of the 21st century, people's views of infectious disease, physicians, and the entire field of medicine had changed significantly. The businessification of medicine had created a rift between physicians and their patients. Administrative heavy healthcare now focused on watching the clock, on a multitude of managerial meetings, and in the US, focus placed on making profit off of people's health and illness. While EMR, corporate compliance, and regulatory meetings and trainings flourished, healthcare providers were at great risk for losing one of their most precious assets, and that is a close and trusted longitudinal relationship with their patients. Unfortunately, what healthcare providers are starting to lose is the ability to communicate effectively with their families that they serve. But very scary, they are and have been and are completely unaware of the emergence of a very devastating and infectious foe. Now, sure, vaccinations have been under attack by skeptics since Jenner's time, but now digitally fueled disinformation and weaponized anti-vaccine attacks are rapidly eroding vaccine confidence. Untrained and ill-equipped to address these challenges, physicians and healthcare providers are at a loss. They're at a loss about the confidence of their own voice, their trust networks, and the ability to influence and impact the populations they serve. Now, this represents that green shape, the 75% of vaccine accepting population that we think of in the US. The yellow is 23% vaccine hesitant. The red is about 1 to 2% of anti-vaccine. And vaccine discussions, which traditionally just happen inside the exam room or the four walls of the clinic, are now happening on a daily basis, millions and billions of times per day, online. And what is happening is now virtually vaccine safety, effectiveness, and even as necessity are being challenged on social media. And social media allows this use of tribalism, right? If somebody's in your crochet Facebook group or your running Facebook group, you already have a tendency to believe them because they're your friend, even though you've never met them physically. And that's very scary. And if you look at Johnson's recent paper in Nature, it talks about how quickly anti-vaccine groups are growing and are on pace to outgrow pro-vaccine groups. So unprepared, seasoned physicians, even faced with vaccine hesitancy in the office face-to-face, down to the bottom right of the slide, oftentimes respond to hesitancy with throwing down fear or data, which they are unwittingly now pushing these vaccine hesitant families to become further entrenched in their vaccine skepticism. And younger physicians, scary enough, are coming out, and the research is showing, are more vaccine unsure themselves. And what this leads to is younger physicians more willing to capitulate to vaccine hesitant families, thinking that they should delay or even skip vaccines. That might be the better or safer way to handle that visit. This further damages the importance of immunizations in the community's mind's eye. Now, physicians lack formal training in communication and active listening into this face-to-face engagement. What's just as worrisome, or more so, is the complete lack of a plan or training on how to deal with communications virtually. Now, The trust network between physicians and healthcare providers and their patients still exists to the tune of hundreds of millions of people, but we don't tap into it because we're not given the training nor the support from our institutions. And therefore, we're at risk for squandering this relationship because in a vacuum, it is being filled by people that are more than happy to listen and provide disinformation. Now, the good news is there are strategies that we can use that can address both halves, face-to-face and virtually. And here we go. Now, face-to-face. This is a methodology to communicate face-to-face. It's called AIMS, Announce, Inquire, Mirror, and Secure. It was created by Dr. John Parrish-Sproul and Dr. Angus Thompson. And healthcare providers in the primary care setting are for certain going to inquire hesitancy. But if you use this approach, announce, that leverages the fact that we know 75% of people are already willing to accept vaccines. So you make a presumptive announcement. Great, you're on to vaccines. If you engage somebody who's hesitant, here's where active listening is taught. This is where you allow people to feel felt. Once they recognize that, you move over to their side of the conversation. You understand, and they understand you understand what's concerning to them that allows you to then have a meaningful discussion. And many of those discussions will again go up into vaccinate. Finally, this methodology recognizes that not every vaccine encounter with somebody that's vaccine hesitant results in a vaccination, but it allows you to focus on the most important precious asset, the trusted relationship, and therefore you secure the relationship and say, maybe we won't give all the vaccines I recommended today, but we can discuss that next time. Really working on building trust and active listening and powerful communication. So AIMS is just one of many methodologies, but one that I use. Now, here's the issue though. This training helps face-to-face, but even in a busy practice where you see 20 to 30 people a day, and most of those visits might not even involve vaccines, millions and billions of conversations occurring online. And if you go out there and try to promote vaccines, or God forbid, to call out disinformation or support a vaccine advocate, you risk being attacked. And that attack can be quite vicious and quite severe. And victims of these attacks, like our group was in 2017 for posting an HPV PSA, can leave you feeling like you have PTSD. And I dare you to talk to some of these victims because they'll tell you that they are vicious. They are there to terrorize and victimize people, as you see. And while we say that there's only 1% to 2% of the population is anti-vaccine, they punch well above their weight because they are globally coordinated and organized. They have strategy, they are tireless, and they are highly effective. And I will tell you, so effective so that not only do they shut down a onesie twosie doc practice from talking about vaccines online, we have seen firsthand where they have shut down quaternary health systems for even daring to post about flu vaccine headed into flu season for fear of an attack. Now, we realized that it stunk to be a victim, that there were no instructions on how to deal with virtual attacks. There were no organized groups of allies to come to your aid, and that they were, in fact, being very effective. So as a result, Kids Plus Pediatrics, my practice, went on to take a stand. And what we did is we did research and published, and that attack is in the journal Vaccine 2019 on the attack, but we also created a toolkit. We organized a digital cavalry of close to 900 people globally from 20 countries, and an international awareness campaign. What we have found out that anti-vaccine people or activists, like all bullies, when confronted and pushed back, in this case with science and data and information, don't want to deal with it, and they move on to a softer target. And so what we've created out of our work was Shots Heard, and you've heard about it, and it basically does all of these things to counter these attacks, and has been quite effective, allowing some people after these attacks to not only be stronger to become, but to become uber advocates. So we have to recognize that the anti-vaccine groups have been unopposed for years on these digital platforms, and they are winning, but it doesn't have to be that way. So as I've mentioned, Shots Heard is a group that we've created that supports, defends, empowers, and galvanizes vaccine advocates. And again, close to 900 members from over 20 different countries. We have a website and a toolkit we're revamping and actually now translating into Spanish, French, and Portuguese just to start. We've also partnered up with Stronger. If you're not familiar with this group, please become familiar. Their goal is to stop the spread of harmful misinformation about science, medicine, and vaccines. And they do this by partnering with organizations like Shots Heard, sharing correct information, and arming people with ways to fight back. So please familiarize yourself. Now, the battle for this, for vaccine hesitancy and confidence and opposing vaccine hesitancy really lies in these two realms, both face-to-face and virtually. And I've told you that there's ways to address both. And recognize that that powerful communication that happens to face-to-face can be made more powerful with training. But it still needs to be complemented with all of us finding our individual virtual voices and working in unison to address vaccine disinformation. And also recognize it is a huge lift to debunk misinformation and disinformation once it's taken hold. What's even better is to inoculate people with effective information. This came out of Cambridge in 2019, and to pre-bunk and give people accurate information about vaccines ahead of time, which is shown to make them more resistant and more recalcitrant to getting affected by disinformation. Finally, my call for action is that we have powerful communication training all the way back to our training programs in medical school, residency, or in any other nursing, public health, whatever the field is. That we need to be trained both in face-to-face communication as well as virtual communication. That is critical. It's no longer an option. We need to have a collective vaccine promotion of getting out there with the facts ahead of the game. And as I told you, it's quite powerful, but also leveraging those trusted healthcare relationships. Finally, we need to organize and have a vaccine defense strategy against these disinformation campaigns, holding social media platforms accountable, while also addressing the often not mentioned weaponized social media attacks against vaccine advocates. That's what I have to say. I am again honored to be speaking and look forward to answering questions during the appropriate time. Thank you.